bank. Ankit, you have given a vision to the world. This is a
Yeah.
very, very good thing. This
Oh, I
can,
agree.
this is a revolutionary idea actually, really revolutionary idea. So this can make a sense actually. This can give a sense of security to the community actually.
No,
So,
I agree. But here's the thing. Just be smart with it. I think we're very excited over the plasma therapy because one, I think it's not a negative thing. It can't make people sicker or worse, but it's also I think it's had good results, but we need more good results, right? We need a lot
right.
more good results. But I think it doesn't hurt, and I think it's a means to keep trying until we do. But I agree with you. We're not going to find a vaccine. We're not going to
I,
have it.
yeah.
Yes.
I don't mean to be a pessimist, but I think that the mutated forms of viruses that we're dealing with, antibodies cannot fight them. Our human antibodies are not designed to fight man mutated forms of viruses. Our antibodies are designed to fight nature mutated forms of viruses, but our human bodies are not designed to fight man mutated forms. We're not.
So,
And I just, until more research is done, I am beginning to believe because of the way this is spreading and mutating, and our human bodies haven't been able to fight it. Um, I believe it's more man-made than it is. I mean, and I could, prove me wrong. This is what I tell people: prove me wrong. Right now, the data shows otherwise. And I try to look at data, and yeah, you have to speculate sometimes, even in forensics. The police have to. I've got this data, circumstantial data, and eventually you put it all together for what? Substantial. Um, and I've heard a judge tell me that one time. Eventually, I'll gather enough circumstantial data that I will find a reason to have substantial evidence at this point. But you got to speculate sometimes. And right now, we're dealing with a ghost. But we have Nick's back
I
and
am. Can
Edward.
you hear me?
Hello, Edward. Welcome.
Yes, Professor. How are you doing?
so
He's muted. Can you unmute?
Oh, you have
Can
to
you
unmute
unmute
yourself.
him?
There we go. Press that magic
can
button.
you unmute yourself because you have
There he
muted
is. There he
Okay,
is.
So good morning, good afternoon, good evening to everybody.
Yeah,
Good
depending where
evening
in
to
the world you
you.
are. Yes.
Yeah.
Right.
So what's the new insight here, Kimberly, about man-made? I'm joining.
Oh, it's not new, actually. It's nothing new. It's a controversy, right? Nobody really knows ground zero. You've got the speculations that it came from bats. Well, we know it didn't come from bats. We do know and speculate very strong that it came from a meat market in Wuhan. So how did it get there? And so you have to take a look at various things. And there for a while, I was doing some research back in February, January, February timeframe that there were labs that were doing research on the coronavirus, not COVID, but coronavirus infections for the lungs of chickens. The labs have been doing this for years to find vaccines for cattle. I believe that something went wrong in one of those labs. The chickens found their way to the meat market. I mean, to me, I'm connecting dots, right? I
The
know that the
chicken
labs
crossed the
existed.
road.
Right. The
Why
chicken
did
crossed
the
the
chicken
road.
cross the road?
You know,
To give you
I believe
coronavirus.
now I think that those labs are closed. I can't find them anywhere. They're gone. And but they were there back in January and February. So I think that yeah, the chicken crossed the road. Can these mistakes happen? Yeah, but you know what? Be transparent about it. Don't hide it. Don't cover it up. Don't run from it. Let's face it together. And if you were doing the research and it was a mutative form, then give us the research and let us work with it. But it was a mutative form. It was man mutated. They were supposedly developing vaccines for cattle. But yeah, I believe the chicken crossed the road, and that's how it got in the Wuhan market. Or, the Chinese guy who was supposed to be disposing of the chickens go, there's a lot of people starving in China. Why do I need to be throwing away the meat? I will take it over here and sell it, make a little money for me and my family.
So I have a
Any of those
question.
things.
So as a layperson, so the implication of this is that people who have had the virus are not going to be superheroes in terms of returning to work
No.
because of potential mutation. Is that?
Exactly. They're finding people are getting reinfected. So that's telling me that this is not of a natural form. That your body, it naturally, we are designed to be able to fight off viruses that are natural. That's just DNA of Earth. And it, so unless science can prove otherwise, but I think it is a mutated form that we're dealing with. I truly believe it in my heart. But prove me wrong. That's what I keep telling people. I would rather you prove me wrong and we find a solution than be right on this one. But there's way too much cover up. There's way too little. They're not transparent. Nobody's transparent. So they're all afraid of sharing the truth. And I hear this from every doctor I speak with. So I think we need to knuckle down, realize that we're dealing with something that's not as natural as we think it is.
Mm-hmm.
And most of the doctors that are dealing with it on front line, like Dr. Art that we had on the other day, he said that they're just dealing with it on a symptomatic level right now. That's the only way they can treat it. There is no vaccine. There is no treatment. All of these drugs that they were touting are really just, it may work for some people, but it doesn't work for others. I kept saying, why not just use your basic asthma treatments, because it is a respiratory, ground zero respiratory. They found sometimes it works, but we don't have enough proof that it works all the time. So
we're talking about prednisone.
just your basic asthma, yeah.
On the research centers and hospitals, but the frontliners who are dealing with the patients are the family physicians. Because people first visit the clinic and the physicians around the corner, and then they go to hospitals and things like that. And none of them are doing any kind of research. So that's
but you can improve your odds. If you look at the whole game, it's like, how can you improve your odds and what you're doing? One way to improve the odds is social isolation. Another one is to wear a mask. Another one is to wear a glove. In other words, everything that you do to improve your odds, the better off you are. The other thing is to have oximeters. Now, this is something that everybody should have, not just the temperature, but having an oximeter, because a lot of the physicians that have been on say, well, we get people walking in the hospital and they're blue. And it goes, they're dead when they walk in because they never tested their blood oxygen level. Now, as an asthmatic, I'm keenly aware of blood oxygen levels. And the thing is, there's little testing devices you can buy for $29 on the internet that can actually test your temperature and blood oxygen level. So not only can we just have to do things smart. One way to do things smart, social isolation. Number two, to do things smart, wear a mask and wear gloves. And we discussed the gloves. They don't really stop the coronavirus, but what does it make you acutely aware of how many times your hand will actually touch your face or touch other surfaces that other people will touch. And at the end of the day, you take your gloves off and you dispose of them because obviously they're contaminated. Everything you do to increase your odds, the better off you are. The oximeter, along with a temperature gauge, then you will know whether your blood oxygen level is low or not. Other than that, you're just guessing. And this is, a lot of the doctors have said that. So then, now that you've done all this, the next thing to do is the treatments. Getting early intervention seems to make a difference mathematically. It actually improves your odds. By the time you get on a vent, your odds are about 20%. That's not good odds. If you're in Vegas, you don't want to go play any game that you only have a 20% chance of winning. You want to play one that you have an 80% chance of winning. So you don't want to go to the vent level because that's bad. But if you do everything to increase your odds, the better off you are. Testing, like I live in a golf club community, and we're in a secured gated community. No one comes in, no one comes out. Not because we don't like people. I'm not really sure if it keeps our people from leaving or people from going. I haven't figured that out yet. But if we tested all the people that were here and they all were okay, in other words, they were all coronavirus free, then they could actually go mingle at the golf club. Right now, the golf club's closed. But if everybody's tested, you could do that. But we have to have testing. Testing is so vital that in Germany, they test people routinely, almost every day. We have the technology. We can do that. And if you tested everybody, let's say that everybody that is going to board a plane, none of them had coronavirus, then get the plane up and running. There's no problem with that. But the thing is, without the testing, you're, again, rolling the dice. There may be one person in the group that's infected, and one person, unfortunately, the way this worked, tends to infect everybody. So there are smart ways that we could actually, and we talked about the casinos in Las Vegas earlier today. You can open them up, but you have to have social distancing. If you added testing, it would actually improve your odds. All the Las Vegas people would like that. Well, we're all at the poker table, but guess what? We all tested. None of us have coronavirus. Then you can all go play Texas Hold'em, guys. Everybody in Las Vegas understands odds. And if you increase your odds, you increase your probability, then there's a greater chance that you won't get it. And if you do get it, you want to increase your odds all the way down the line. And by doing that, of course, is early treatment, early intervention, and don't go to the vents. And I know they're mass producing vents, but that's the end game, man. That's like throwing the Hail Mary. Hey, we didn't do good in the football game. Let's throw the Hail Mary. Come on.
So we know though the economics, and that's why we're here today with we're here. This is Economic Monday. I've already realized it's not the drugs that we're going to make money on in this whole mess. It's going to be the test, because they're ordering the test by the tens of the millions right now. And how I know is I'm kind of intermixed with some of that. So, but what are your thoughts, Edward? We're in this economic mess. We've got one stimulus out. The whole world is in a mess, not just the U.S. What is your thoughts on this?
So how deep is the yogurt? Is that
how deep is the yogurt? Can we put some blueberries in it?
So as we transition to the economy, let me just take note. I think the implications of what Kimberly and Nick are saying. Number one, we're not going to get herd immunity.
Right.
Number two, if I have had this awful disease and I survived it, I'm not a superhero.
Right.
So in terms of opening the economy, it's going to depend much more on, am I right, real-time testing, and individuals exercising good judgment, and as Nick said, reducing the odds every day.
Sure.
It's a constant battle.
Well, one more thing. You're missing one more thing. And every doctor that's been on our show and every other show, and including there's a new doctor in Durham who's a pulmonary expert, says immunity. Build your immunity. Period. So that is the key factor. If you're testing consistently, so we're going to have to get a test that determines that our immunity is constantly up. So that is your life cycle right there, is your immunity.
Yeah. And actually, IBM did because one of the doctors mentioned quercetin as a possible thing that boosts your immunity. And IBM actually ran their mainframe, which sits in Oak Ridge, Tennessee, of all places, and it's called Summit. And what happens, they ran 77 potential cures and things that would benefit. And one was quercetin, which shocked me. It turned out as number 5 or number 7 on their list of 77. So it has what we call some merit, and that perhaps having people that would take a supplement like that would help build their immunity system. So in the event they did get it, they would have a lower probability of actually passing away. Because remember, if we're going to play the odds again, let's look at the odds from 0 to 60. If you're 0 to 60, the odds of you passing away is actually pretty poor. The real problem is you go over 60, then all of a sudden the odds go up to like 3%. Over 70, you're at like 5 or 8%. By the time you're 80, it hits like double digits. Okay, so if you're looking at the odds, if you're young, and if you were young and had no pre-existing conditions, your odds are infinitesimal that you actually would pass away. Under 60 with no pre-existing conditions. All the people that passed away under 60, or not all of them, but most of them, had a pre-existing condition. They had diabetes, they had high blood pressure, hypertension, asthma, another condition along with the COVID-19, and that caused the higher mortality. But as they head over age 60, notice the thing is that's the real problem, especially with a pre-existing condition. Now, one argument is saying, well, let people under age 60 go out freely, do everything, and quarantine all the people over age 60, and tell them that they can't play the game freely. And who knows, that might actually be the way of the future, that when you're in those high-risk categories, or you're under age 60 in a high-risk category, that you're going to have to be a lot more vigilant. But if you had a bunch of people, seriously, that went to a restaurant and they're all 40 and less with no pre-existing condition, even if they were to get COVID-19, the odds of them passing away are very, very low. And so I think ultimately it will become a numbers game and needs to be explained. Herd immunity is actually a numbers game. It means so many people have it that the virus has nowhere to go. In other words, we've infected, let's say infected everybody here. Well, there's nothing for the virus to do, so it dies. Well, I don't think that's going to be a solution. I don't think we want to infect so many people that the virus dies because it has nowhere to go. So I don't think herd immunity is going to be a solution. But
I don't think it's going to be safe. It's not safe.
Right. The mortality is too high. See, that's the real problem. The mortality numbers are too high. Realize we do have acceptable mortality statistics. I mean, in opioids, 5,000 people a month die in the United States. That's 60,000 people a year, but we made that an acceptable statistic. And so if you have acceptable mortality versus unacceptable mortality, right now around 60,000 in 2 months, we have an issue with that, and it's rising. But there are things that you can do. I call it smart solutions. In other words, you do as much prevention, build your own immunity, put your defenses up as much as possible, and then already get prepared for the treatment. Make sure you have an oximeter and something that will test your temperature, because one problem the doctors have said, can you imagine? You don't even know you have a low blood oxygen level. Now, as an asthmatic, I know, so it hits me and I go, my blood oxygen level is down. I can feel it. But I've had so much experience with it. I understand very few asthmatics actually die because then immediately they hit albuterol, they hit prednisone, and they actually don't die of it because they're aware they've got a respiratory issue. But people that have never been asthmatics don't know their blood oxygen level just went down. They don't know that they're about to die. They're turning blue, and then they come to the hospital, and then the doctors are going, you're too little too late, guy. There's not much we can do for you. So I think there's going to be some smart solutions, but unfortunately, Professor, I don't hear that many smart solutions from our leadership at this point in time. I wish we would have smart solutions.
Well, let's hear from Edward. Let's see what kind of smart solutions he's got for us, Nick.
Sure.
Let's hear from Edward.
All right.
Because we just scared him.
Yeah, you did on multiple ways, but I'm not going to crawl under my desk.
Okay, that's what I did during the Cuban Missile Crisis. No kidding. I actually was a person who crawled on the desk. I grew up in Tampa, Florida. They said, when that nuclear bomb hits, buddy, get underneath the desk and everything's okay. So I did that.
Yeah. So, but it is scary because last time that we got together, I talked about 3 periods. And we have the flattening the curve period, and then we have the between period, and then we have vaccine, post-vaccine. And I think what you're saying is that the between period may not be between anything. It's going to just be the future, which is scary. But let's just put that aside. You mentioned leadership, and I've been thinking about this, and it turns out that there's an economist that should be brought into the picture and into our discussion. His name is Tibout, Tibout. He was University of Michigan trained, taught and did research at Northwestern, and he studied the competition among states and cities and towns and counties.
Mm-hmm.
This research was picked up by Nobel Prize winner James Buchanan. He won the Nobel Prize in 1986. Now, why bring up this? I think it's at least, I'm taking a US point of view here, but I think we're going to enter a fascinating period when we're going to run a lot of different experiments across states, cities, towns, counties. And we're going to learn. So that's, I think, very helpful. And we're going to have competition among states. Now, this is central to the Tibout Buchanan view, is that you always, if you're a government leader, you have some degree of competition due to the threat that individuals can move over time. So if, for example, you don't do a good job reopening, you may lose out, not just economically, but you'll have people leave. And I think this not to put on too much of an academic hat here, but we should be paying attention to the differences in the approaches used by different states and learn from them. Now, my own view is that the opportunity for leadership in terms of opening up the economy is it's important, but it's limited. What do I mean by that? Number one, it's important for government leaders, say governors, to give clear guidance about the phenomenon Nick just talked about, which is if you're over 65, and especially with a pre-existing condition, I mean, whatever is said about opening up the economy, you have to be really careful. Mm-hmm. So give guidance, make sure hospital capacity is up, and try to accelerate the testing routines, which I now understand based on the previous conversation are going to be much more of a real-time, everyday activity central to safely opening up. Now, after that, here's the limited part. I don't think government can do a whole lot. And I don't think they should do a whole lot. If I walk into a restaurant and I'm a senior citizen and I see that the tables are all filled up and people are too close together, I don't have to go. I don't have to, sit down and expose myself. And if I'm a golfer, this one I'm bringing up because I am a golfer, but the governor of Illinois just said, we can have golf, but we can only have 2 people play a hole at a time, no more foursomes. This is the kind of micromanagement that I just find mind-boggling. And it's not Democrat versus Republican. I looked at the instructions coming out of the, highly esteemed governor of Maryland. They're too complicated. Mm-hmm. We just have to tell people, exercise good judgment. And then the other, and this is my last point, Nicholas, you mentioned the idea of acceptable mortality mm-hmm. and unacceptable mortality. Mm-hmm. I think it's very important. Right now, all we hear about are deaths from COVID-19. And we better frame our expectations such that we understand there are going to be deaths. Mm-hmm. And what I fear right now is that government leaders are so cowed by the public health experts. We should listen to them, but we have to craft policy that is not just what they are telling us. We have to think about opioid, like you said, depression, child abuse, schooling, development of human capital. This is a difficult problem, and we're in a bad situation. We have to think about total costs, total benefits, total risk. And we can't, hopefully we're going to be smarter when we reopen to realize that we're going to have some deaths from COVID-19, but we have to press on.
Mm-hmm. Yeah, and I actually live in a country club, so we have 2 18-hole golf courses and like 24 tennis courts. We're really cool. And the golf club is open. But the reason why, think about it, everybody takes their own individual cart, okay? So there's already social distancing when it comes to playing golf. When they hit the ball into the hole right now, they've actually designed the hole. I don't know. Yeah, right. You just pull your own golf. You pull your own golf ball out. So golf works. And also another vital statistic: the NFL had their biggest day on the draft in terms of viewers. They had 55 million people watch the NFL draft, which was the biggest ever, given that Hawaii Five-0, one of the biggest shows on television, has 7 million. So they actually went off the charts because, frankly, people are staying home, not having anything better to do, and they're watching the NFL draft. I mean, it's just kind of the way it is. But see, the real problem, I mean, this is what I'm looking at, is that we need to hear from the medical doctors and the people that actually work in that particular industry.
We do.
What their solutions are going to be. So Friday, we had like 9 medical doctors on. So the thing is, we can listen to what they have to say, because some of them work in the front lines and they have a better understanding of where we are and what we can do. But yeah, we're going to have to take some self-responsibility. But think about it, Professor, how much self-responsibility people like to do unless they're almost told to do it. Like down south where I live, our obesity rate is 40%. So we already start with a mathematical disadvantage that people already have a pre-existing condition. Why is it 40%? If you ever come to the rural South, and I happen to live in the rural South, at least that's what I call it.
Cracker Barrel.
Yeah, the best restaurant is a Cracker Barrel.
I'm telling you right now,
Hey, listen,
Cracker Barrel is our problem.
When I moved from Seattle, because I run an actuarial firm, I moved from Seattle over to here. My wife said, the best restaurant's a Cracker Barrel. I said, you got to be kidding me. But she was right. Cracker Barrel, and then fried food everywhere. So everybody here is getting fried food. They're getting fried Twinkies. That's one of the big things here. And then frankly, if you're over here, you're going like, wow, everybody here is morbidly obese. Okay. Now, why are they that? Because you would think that people don't need to be told what to do. Okay, that the Adam Smith invisible hand would work. I mean, that's what we hear from obviously the economists at the University of Chicago. It would work except the virus. Yes, but the problem, Dr. Snyder. And by the way, University of Chicago had two great people. The one who created the Booth School of Management, and also his partner Rex Sinquenfield is actually a big chess promoter in St. Louis. Matter of fact, Rex is very well known, and I was 3-time Florida State chess championship, so I follow chess a lot. Okay, so the thing is, I follow a lot of the chess players, and so, but Rex donated all his money to chess, and Booth donated all his money from DFA over to University of Chicago, which I thought was great. But the thing is, there's a lot of smart people out there who can do smart solutions if we allow them to do that. If you let a regular person wander on their own, you need to go to rural Mississippi and see the solutions they're going to come up with. It ain't going to be good. It's just the nature of the beast, and the invisible hand, the virus ignores it. I mean, the thing is, let's face it, virus doesn't care whether or not, well, one state's going to do better. They don't. They're going to come and infect anybody, no matter what the economists say. And if you want to look at the economies, look at the economies around the world. ANCIT puts it on every day. Who's doing the best per death? It's actually Germany because they're testing people, and New Zealand because they did sequester people. In other words, there was actually some leadership, a hard word to describe. I mean, it is dangerous, I agree, to give politicians that ability to make decisions.
Let's take another look at an impact that has just really mind-boggled me, because I think it's going to impact our economy greatly. Crime rate has dropped considerably, and Miami of all places, reported 0 murders in 7 weeks. They have never done this before since 1957. 0 murders in a span of 7 weeks.
Can you believe that? The coronavirus shut down murders.
Where you look at some things have adjusted us bad and poorly in the economics, maybe we can balance it out based on how we're going to have to spend our money. We've cleaned the ozone area, so maybe we don't have to spend as much money on doing the cleaning of the ozone and research of that. Maybe we need to pull back on some of our space research. I mean, this is not my agenda. I'm just saying maybe we can take a look at some of the things that we're spending our money on, like you do at home, right? And say, hey, you know what? But I don't want to say let's reduce our police force. I still think we need the same amount of police, and they need the same amount of resources and funding. But we've reduced crime considerably. India has reduced crime.
There has some benefits. Crime has been reduced, and over in India, ANCIT knows this, Mohammed knows this, they can actually see the Himalayas now. Do you know? Believe what's that?
We are still happy. We didn't get a stimulus. We are still happy, and we are just trying to understand what Americans are doing with the stimulus.
What we're doing with the stimulus.
I get this all the time. What are you guys? And why are you worried?
And the most important thing, rather than getting a stimulus by the government, the people have donated back to the government.
Yeah,
millions of dollars.
In
Really?
India, yeah.
Is that
in India?
Is that in India?
Okay, and the government took from their own paychecks. The government took from their own paychecks and put back into the economy. So
I would like to ask Professor Edward that when you talk about stimulus, government is giving away a lot of money to the people. Why can't we cut taxes for a year and then manage the economy like that?
That's my idea. Yeah. That's what I want. Nick knows I love to do that. Cut the taxes.
Okay, so I think I'm here in part to stir things up a little bit.
Yeah,
Right?
that'd be great.
Well,
Yes.
yeah, let's stir it up.
do it,
I
man.
love to stir it up.
Listen. I understand, Kimberly. You're finding some silver linings here.
Yes.
Good. All right. 20.
It is good.
20 some percent, according to my colleague at Yale, 21% of us, or maybe 29%, somewhere in there, can work at home. Well, that's great.
Mhm.
I mean, I get to clean out my stuff and sell on eBay and reflect and so on and so forth. But 79% of people are really in big trouble. They can't work at home. Our unemployment rate is skyrocketing, 15%. Small businesses are getting hammered.
Yeah.
So I do appreciate the silver linings, but it's a tale of two cities for people like us, probably, and people who are trying to actually go to work and run small businesses. So I think we have to get the small and medium-sized businesses going. And then I'll stir up one more thing with Nick. And I think this is always a tough problem. How much direction do you give to people, and how much do you encourage them to make decisions on their own? But you just said exactly, 5 minutes ago, exactly what people should be doing. And don't we, at some point, especially given the potential duration of this crisis, need to trust people and really tell people this is on you? And the other reason why I would say, I'm a little bit concerned about putting too much guidance out there and having the government do everything in terms of deciding, is it flashing green or flashing yellow, is that I don't think governments can figure out all the myriad of situations in which we're going to have to exercise judgment and reach decisions and enter into contracts and transactions. It's just too complicated. So I think we're stuck with individual judgment, aren't we?
Well, it would be nice.
Wow.
I mean, the thing is to have self-responsibility
Wow.
is something that you have to preach people to do. But to think that the humans are going to operate like computers, if you tell them to do A, they're going to do A, that's not true, because we're always going to gravitate toward the mean. And so the thing is, I have to be beat up all the time, because the thing is, I love this thing called junk food. See, there's Pringles right there. Okay. And if somebody like my wife doesn't come in here and rip my Pringles away from me, this thing will all be digested by today. And see, that's the reason why you need to have some leadership. And I'm very fortunate. My wife and my dog tell me what to do. But a lot of people don't have that ability. And so what they'll do is they'll stay home, watch IBM TV, and eat Pringles all day. And then they gain weight, and then they won't do anything healthy, because somebody has to, unfortunately, give them what they call guidance. I totally agree with the macro management, because as a tax attorney for 37 years and a professor at Northeastern University's graduate tax program, the Internal Revenue Code is bloated with micromanagement. It's insane. No one even knows what the rules are, because there's way too many of them to know. And why do they have them? Sometimes they're put in like 1974 and they just stay there because no one reviews them. So the government does have that tendency to what I call micromanage a situation that doesn't need to be micromanaged. What we need is good management, also individual responsibility. No one ever, doctors don't even want to tell it. I know Dr. Ratner, do you ever tell a patient who comes in saying, wait a minute, you're way too overweight, you need to lose weight? Now, some of them do. They say, look, this isn't good. Your BMI is out of proportion. Because it's really hard to tell people that they've got to change to better their own particular situation. One of the doctors we had on here was saying that recommended that the client be intubated and put on a vent immediately. They were in deep trouble. The client goes, no, I don't want to do it unless I'm under cardiac arrest. And he goes, you know what the odds are when you go to cardiac arrest, I put you on a vent? It's like 0. And you know what happened to that client? He died. I mean, and so the thing is, you do have this Darwin, if you believe in Darwin awards that are being handed out right, left, and center. But I believe part of the reason that Darwin awards are being awarded to these people is they're not getting the proper education in this area that they could be given. And then, of course, it could be the human choice. Do not resuscitate, do not intubate, and then go ahead and die. That's what I call an acceptable mortality statistic, which we do have in this country. At least life insurance companies use them all the time. They go, we know that these amount of people are going to pass away every year, and we expect it. This, unfortunately, for the life insurance industry is not good, because you have now unacceptable mortality statistics that aren't built into the model. So some insurance companies, even today, because I got a report from my company in Salt Lake, they go, if you're over age 70, a lot of companies are not going to underwrite you. You don't get insurance.
All right. So I just wanted to offer the contrarian view that I have a lot of faith in the American people, in the resourcefulness and heroism of just normal, everyday people. And I already
that word.
Good to have some positive thinking out there.
Well, as a surgeon, I've seen people do pretty extraordinary things. And I think that we are witnessing today people doing extraordinary things, like expecting people to shelter in place. Yet here we are all together doing this together. Right. And I have had multiple conversations of people who just wanted a different idea about how to pivot. So for example, I was talking with somebody who works at Indian casinos, helping create intimate environments. Mm-hmm. And he was just bemoaning the fact that what's going to happen to his business? It's dead. And I said, no. I mean, how is it that you can create an intimate kind of experience in a time of social distancing? Mm-hmm. So I think if we just put the seed out there, that go ahead, let your imagination run wild. Let's see what we can come up with. I see that as our future.
Mm-hmm. Yeah, and there's a lot of different ways to do that. There's a lot of different ways to do that, because the casinos certainly can have social distancing. If you go to Las Vegas, you're going to see there's a lot of these slot machines, and certainly you can space them where people aren't getting close to each other. You can disinfect them, but also you can do like Germany. They test people. If you had all the people that come in the casino and they're all clean of COVID-19, then you just actually did is you increased your odds that you won't get that. It's all about the numbers. Can you increase your odds so that the odds of you getting it are minuscule, and the odds of you, if you had to go into a hospital, becomes minuscule, and then it becomes basically acceptable mortality because very few people die.
But we're talking about re-entry policies, but sure. I think right now the concern is and I have to agree with Edward in many ways, that that we have to get the small businesses back up and running again, because they are what feed our community.
Of course,
small businesses are the lifeline and always have been. And if we let the small businesses go, and what we notice again, Nick, we said the stimulus package was truly a bottom up. It wasn't. Right. There were companies that got $20 million that could have gone back to the small companies just as easy. And my thing is why are we giving Ruth Chris $20 million when that $20 million could have gone to my small medical practitioner that is out of PPE equipment?
I can answer that question real easy. They have better lawyers. Okay, so anyway.
No, they have better CPAs, and they filed. Here's where it was unfair. They had CPAs and lawyers who read the bill the day it came out, rather than waiting for next class, and they filed the paperwork a week before you had to file.
What do you mean read it before it came out? We read these things while they go through committees in Congress.
I know, that's what I was doing.
So the thing is, it's not like, we're going to read the bill as it come out. No, the thing is, we got people tracking these
that's what I'm saying.
As they're going through the House Ways and Means Committee way prior to that getting passed. So when it comes out, we can isolate and make our move for our client. Come on.
Right. But every Joe and Jane out there that is a small business didn't do that.
Well,
they were waiting for the red flag. They were waiting for the checkered flag to drop and go race cars ready. They were waiting for that. They did not have the education.
How much a legal attorney charges for filing a stimulus in US?
Well, see, the thing is, they actually have a scale of what you can charge if you're applying for the loan. Then you have your independent hourly rate, which ranges around $450 to $750 per hour. So the thing is, you got two ways to bill.
They ran out of money.
As an attorney,
it doesn't matter. They ran out.
No, we got refunded again. But remember, as an attorney, you have your two best friends Bill and Sue.
Bill and Sue.
Okay, you always got to remember that, because as long as you have Bill and Sue with you, you're going to do well as a lawyer in this country. So,
No, the mortician's doing better than both of them right now.
Right now, they're doing better than both of them. But the thing is, right now, you could actually reopen a lot of places, including the casinos, as long as you do it smart. Because there's a lot of space. And also small businesses. They allow Walmart to be open, but my vacuum cleaner, I need my vacuum cleaner fixed, okay? There's not that many people that are in that shop at any given day during the good economy. You can easily socially distance. Why did they close my vacuum cleaner shop? They don't need to do that. Okay. Yes, Professor.
This is the example I've been waiting for. You've got Pringle crumbs on the floor.
Yeah.
You need your vacuum cleaner.
Yes.
And we don't need the government to tell us that the vacuum cleaner store should be closed. I
don't.
I mean, we have
guidance.
So I think it just needs to be knowledge, though. They were never transparent with us. Okay, CDC had high classified meetings and reports that they were generating back in January. I even saw a press conference where a couple of them got reamed by a couple of senators. Why didn't you just tell me? Well, that was classified. But they weren't transparent. And if you don't have the knowledge, you don't have the right stuff to fight this off. If I had the knowledge of, Kim, you could keep your store open, but if you have a lot of people in there at one time and you're not keeping things disinfected, somebody might get sick or you might get sick, then I'm going to say, okay, here's my policy. You come into the store, you wear a mask. Yeah. You come into my store, you wear gloves. Then I wipe everything down, one person at a time. But I didn't have that knowledge. They didn't share that with me. They were not transparent. They lied to us.
And the other problem with the government is, Professor Snyder, they have one rule.
They were honest.
To everybody. They do one rule, it applies to everybody. So everybody has a small business shuts down. That is not smart government, as you know. That's dumb government. I mean, and so the vacuum cleaner guy got shut down, and I'm going like, why? There's nobody in his store. In the meantime, you can walk in and out of Target, walk in and out of Walmart, where lots of people are there, and they guide you through little things. But I could go to my vacuum cleaner store. There's only me, the vacuum cleaner person, and when I'm in there at any point in time, there's only one other person there. But they take one rule, it's applied uniformly through everybody. It's just not smart.
But transparency makes you smarter. Knowledge makes you smarter on how to deal with the situation. And if they had been transparent and honest to us up front, we would be like Hong Kong right now. If you look at the data tells the story. Hong Kong never shut down. They closed off international flights. They closed off China, but they never physically shut down. All their businesses operated. Why? All of their businesses did this.
Yeah.
All right. Restaurants were only allowed 2 people. Why? Because they told their people the truth. Yeah. So I agree with you, Edward. If we were given the right information, we can. But if you're not given the right information, you're a complete idiot.
And we already have the information.
You're flying an airplane when you should be flying a car.
Ankit, put up the world information. Ankit, you have the world information. We already have the information out there.
I agree with you.
Statistics. Because if you look at the data from the rest of the world, you can then figure out what this world should do. We don't need the states competing for good ideas and bad ideas when the world has already done that for us, and we can see what the bad ideas and the good ideas are out there. At least there's data indication. It's not going to be 100%, but it can give us data indication. And Germany, of course, I guess we'll eventually go. There we go. Let's take a look.
I have faith in people if you give them the right information. Just like Dr. Vicky said,
the United States is the world leader. Look at this, Dr. Vicky. We're leading the world in coronavirus. We predicted over a month ago that we are going to have 1 million. We did at IBM TV, 1 million people infected by the end of the month. We're getting really close to our number.
We're almost there. Well, this is 3 million for the world.
That's for the world, and that's the deaths. But let's scroll down where you can see the data from the rest of the countries. This is real.
U.S. We're right where we predicted. We're right where we predicted, Nick.
Now,
that's the difference between you and I and them is we know how to do data.
Representative, sir? Is this representative of the best healthcare system in the world? Is this representative of the world leaders and the group that spends the most on the healthcare system. Is this the result you would expect from the world leader? I say no, this should not be the result. So somewhere along the line, there has been a failure in our system where we wouldn't be the world leader in a place we really don't want to be the world leader. However, when you look at this, the most important data actually appears third from the left. Deaths per million population, 169. Remember, deaths are just raw data, but if you look per 1 million population, that becomes more important. We have 169, and we see Germany at 71. Germany beat our tails. I mean, you know, we have more per 1 million. And then you got to figure out, well, why did they beat our tails? You go further down, you see Russia and China, and you discard the data because the data may be better.
Let's go even better. Let's go down to Hong Kong because we have them on the show with us a lot. So we get to hear. They never stopped working. They never stopped.
Yeah, but they assuming, again, you've got to assume the data is good. Is that it? 4 deaths? They have, but the population's only 7 million, so it's really death per million.
But it's 0.5
Lord.
per 1 million. Let's see if I can get it.
No,
Every time I read.
How far down is Hong Kong?
No, you went further down. You need to come little up.
You found Hong Kong?
Ankit's got a better memory for these than I do. And I don't know if they move around based on their.
Yeah, the data's updated.
As you're looking for this,
there it is, right there. There it is.
Total cases 1,038. Deaths per million. Whoa, that's good for them. 0.05. And you know that's the important thing. That's not very many. So the thing is, whatever.
That's somebody we need to pattern ourselves after for a pandemic situation.
Check Hong Kong versus New York City. Who wins? It's not even close. So who would you want to follow? What the people did in New York City or the people in Hong Kong? And you can argue, well, the people in New York, they live on top of each other. What about Hong Kong? I mean, it's not like they're spread out in Nebraska. Come on, they're living on top of each other, but they were managed properly. So the thing is, managed properly made a big difference. They did close down. They do wear masks. They do self-protect. And the thing is, what is the total result? Well, they have 4 deaths and 1,000 cases out of a population of 7 million, where we're off the charts in New York City. So somewhere along the line, there's been a big failure, and they're right next to the epicenter. Now, the only other argument I can see is the Hong Kong data is incorrect. In other words, we're being lied to. But if the data here is correct, then we have some really serious things we have to look at. I believe the German data is correct, but we do have a lot of data that's already in, and we can hypothesize from the data what our moves should be next in terms of the virus. And some of the data is good. Some of it's what we call corrupted bad data, but there's not much you can do about it. You can only hypothesize which ones.
So Nick, I'm gonna before I get more depressed.
Why are you Professor, you just go play golf.
It's been great interacting with you, and I look forward to the next opportunity.
Okay, great. Well, good to have you on, and thanks for coming. And this is another good thing we learned from Natase, whatever it is.